So with this, I think let's go and start. I will start my presentation, and then the subsequent presentations will come. So as I was discussing, angiogenesis we have been taking this for last almost 5 years now. And the first thing we did in COVID times was a web meeting on inflammation and neovascularization. JB was involved in that, and that had a very big audience at that time. And yesterday also I was talking about him, then he said, if he gets time, he will come. So the topic is actually very pertinent. The only thing is, only few people are aware about it. Professor Sandeep has done a lot of work on this. The question is, why this correlation between inflammation and neovascularization? And as the photograph shows, that these two diseases, they coexist. So the question is, are they a continuum of the same process? So everybody is discussing about, when we talk of angiogenesis, we talk about VEGF release, and the common insight is hypoxia. But before that, a lot of things happen. So we have to look into things beyond VEGF. Already, one more salt is there in the market, which is talking about other receptors like ANG2 and ANG1. So what I understood was there are two types of reactions. One are innate to the system, and other is autoimmunity, which is expression of through tissue response through the cells which come to the point. And if they are optically visible, we talk about uveitis. And now when we talk of inflammation, actually we are not talking of uveitis, but we are talking about intracellular things which are happening and which is responsible for all the disease manifestation. Retina is an immune competent tissue, and there are so many cells, as mentioned on the left side, which are able to produce tissue response. So that is the difference we have in the retina. Now, I was discussing in the last meeting of UP State Ophthalmic Society about inflammation, and then somebody said, why don't you go and read Robbins? So then I went and read Robbins. And this line is very catchy. Process of inflammation is fundamental to virtually all clinical medicine. So there is a cellular component which comprises of leukostasis, margination, chemotaxis, phagocytosis, and there are chemical mediators which will process the inflammation. So when you see inflammation, it will either resolve, or it will heal, or it will cause fibrosis, or it becomes chronic, and then angiogenesis comes. So this is the various courses taken by the inflammation procedure. And these are the chemical mediators which are released when inflammation is there. So there is a self-derived, some chemicals are cell-derived, and others are systematically derived. These photographs are very catchy and very interesting, so I just took it from the book. And that is the chemical cascade which is involved in inflammation. We know about arachidonic acid pathway, and these are the mediators which are working in the inflammatory environment. So let's take the example of diabetic retinopathy. How metabolic disturbance will evolve into oxidative stress, release of pro-inflammatory mediators, will cause ischemic immune response, that will cause disturbed vascular health, and then edema, and then angiogenesis. So if we talk about angiogenesis, how the cells they grow is the pericytes will move, endothelium will grow, and then pericytes will come down. So that means some growth is required, and that is why these growth factors are coming into picture, and there are 4, A, B, C, D, E. And yesterday somebody was mentioning that VEGF-A is probably the most important one. The other factors are FGF, which are 20 in number, and angiopoietin, which are 1 and 2, which are basically dealing with pericytes. So there is hypoglycemia, which leads to activation of this inflammatory cascade, which creates pro-inflammatory response, ischemia, and then there's VEGF release. It creates a low-grade inflammation, and then the blood-retinal barriers are affected, endothelial dysfunction comes, and the disease develops. So this is all discussed so many times: hypoxia, VEGF release, angiogenesis. But before that, there are so many things which are in the process of targeting when we are talking about the clinical studies, and we are likely to hear more about it. And that's the correlation of inflammation and neovascularization. That is why we have used the term retinal inflammatory neovascular conditions, because whether we are dealing with CR, branch vein occlusion, whether we are talking about diabetic retinopathy or other diseases, the etiology remains same. And that is why a composite term has been used. Thank you very much.